I'm Joanne Pollock. Welcome back to On the Art Trail with Joanne. I'm here today with Barbara Collins, and Barbara is an art therapist in Guelph. And Barbara, thank you so much for agreeing to do this interview with me today. I'm greatly looking forward to what you can share with us, because you do indeed have a very interesting profession. So art therapy has been around for a long time. I understand since the 1940s. And it was primarily started to help World War II veterans overcome some PTSD issues. So how has art therapy changed since those early days?
I'm not sure that it's actually changed since then. Perhaps some of the techniques are different. The understanding of art therapy has grown over that time. I would suggest that the training for art therapy has become more significant and more readily available. So we do see art therapy being a modality that's available much more readily in the community than we would have certainly 10, 15 years ago. It's becoming much more mainstream, and it has actually been included as one of the practices that is covered under the College of Registered Psychotherapists. In order to practice art therapy in the province of Ontario, you need to be registered with the college. So it's certainly progressed from that perspective.
So there is a college in Toronto. Are there other colleges in Canada or just in Toronto?
There's actually many art therapy training institutes across the country. I studied at the Toronto Art Therapy Institute in Toronto. The college I'm referring to is a college that was struck, I think, in 2015 by the government at the time, the Liberal government, and it is called the College of Registered Psychotherapists. And in order to practice art therapy in the province of Ontario, you need to be registered with the college.
So you have a lot of educational skills behind you, Barbara. What are they, and what is required to be an art therapist? So you're registered with the college. What other skills are necessary?
Right. You would need to train with one of the institutes that we've talked about across the country, and that involves 2 years of class time where you're studying many different aspects of psychology, different modalities as far as engaging clients, whether that's with cognitive behavioral therapy or dialectical behavior therapy, solution focused. Those are different skills that an art therapist would have as well. And you'd also do a practicum during your time of your training. And there's a major project or a thesis required at the end that you would do with the clients that you worked with on your practicum. And then from there, you would be required to do, I think it's 750 client contact hours in the community where you are paid as an art therapist.
Oh, good.
In order to be able to be registered with, I'm registered with the Canadian Art Therapy Association. You can also be registered with the Ontario Art Therapy Association. And that all that time that you're working towards your registration, you are being supervised by an art therapist who has obviously been designated the supervisor in the area that you're working in. And then from there, you would need to apply to the College of Registered Psychotherapists in order to be registered with the college.
Do you mind me asking what you did your thesis in?
Absolutely. My thesis was, the population I worked on were adolescent females who resided in a secure facility. And my thesis topic was the role of art therapy in enhancing the sense of self with mid-adolescents who are residing in a secure facility.
Do you need to be an artist to be an art therapist?
No, definitely not. And many people who would think about coming to work with an art therapist may have the understanding that they're going to learn how to be a better artist, that I'm going to teach them art skills in order for them to be able to increase their ability from an artistic perspective. And those clients are often very disappointed when they meet me because I am not an art teacher and I don't teach art skills. And maybe this is a good chance for me to kind of explain the difference, could I?
Please do.
So I think about an art teacher being a teacher who's trained to teach, and if I'm in that class, I am a student and I am there because I'm going to get a credit for the work that I'm doing. Typically, an art teacher would tell you today you're going to create this particular project, you're going to use this particular medium, you have a week to complete your assignment, and it's due on this date, and when it's handed in, you expect it to be judged or it to be marked, to be graded, And then once it's completed, that mark might be posted so everybody knows how well you did or didn't do. And then it may even be put on the wall for parent-teacher interviews back in the day, I guess, before COVID, and everyone else can enjoy your piece of art. That's a pretty vulnerable way to experience art from that perspective. In contrast, when you're in an art therapy session, you are working with a professional art therapist who has been trained to use art in therapy. You are working in a confidential, safe environment. The artwork that you produce is completely at your discretion. So I don't ever tell a client, today I want you to draw this.
Right.
I would invite them to use the art supplies and encourage them to express how they feel. And they can choose whichever supply they would like to use. There's always markers, chalk and oil pastels, colored pencils, crayons, and paint. And so it's their choice as to what they use and to how they use it. We often will discuss why they chose a certain medium or what their artwork means, of course, but there isn't that level of judgment. Actually, it's a very non-judgmental and a very safe environment for clients to be able to make connections to how they feel using the art.
So what kinds of tools do you provide, Barbara? Paint, presumably markers, colored pencils. What other things do you use?
So with some clients, I've done sewing, so being able to make a self-soothe pillow that the client has actually made. Clients who struggle to fall asleep and to settle in at night, making their own pillow and learning those transitional skills so that they can actually sew their pant if it rips is a really great coping skill as well for them. We also use paper mache. One of my art choices of my preferred way of using art is paper mache, and so I'm always happy to be able to introduce that to my clients as well. Being able to take newspaper and masking tape and put it together to make something of value for a client can often be a very interesting transitional piece for them to go from their very low self-esteem, where they feel like they are the newspaper that gets thrown out at the end of the street and really of no value once it's been read, and make it into something beautiful, something meaningful. That transition for the client and the contrast of how that happens in the paper mache is always an interesting parallel process.
We're going to take a short break, Barbara, and we're going to be back and we're going to talk about some of the various pieces of art that are here in your studio. So we'll be back in a moment. So we're back with Barbara Collins, who is an art therapist in Wellington County, in Guelph actually, Barbara. And as I look around your studio, I'm quite intrigued by the artwork that is gracing your walls. And also you have some things in front of us. And perhaps you could talk to us about what we're looking at here on the table.
Yeah, I'd like to start by just honoring the clients who have given me their permission to share the artwork, certainly without any contact or identification as to who they are. But I just want to acknowledge that, that's very courageous of them. So yeah, a few of the things that I have as examples of art therapy and how it can benefit a client is we often do a mask. And the mask isn't a COVID mask. It's an opportunity for a client to think about how they see themselves on the outside, how others maybe see them on the outside as well, in contrast to how they see themselves on the inside. And this is a really powerful tool for clients to be able to really sit and give thought to how they feel in contrast to the mask that they may put on every day to be able to hide those feelings. And one of the things that I often offer in the studio is collage, because if you can't find the words, if you're feeling numb and just aren't able to articulate how you feel, collage can be a really helpful way to sort of inspire what you're actually thinking about and to label it and to give it names and language that makes sense. So I think this is a really interesting example. The outside looks pretty cheerful, sort of bright eyes, a bright smile. The words, I'll read them to you. Strong, positive, no stress, sunny, and happy. Wouldn't we all like to have those words to describe ourselves as to how people see us on the outside?
Yes.
And so let's compare that to the inside. On the inside of the mask, the words are overthinker, sensitive, stress, lost, scars, and worry. And so as a therapist, I would be really curious to understand from the client's perspective how hard it is to keep this mask on the face all the time to hide the incredible contrast that they're feeling on the inside. And those tears that are falling out of the eyes, how often do you feel like this? How often do you feel like crying, although you actually are presenting as this happy, strong, no stress person? And that's a wonderful way for the client to be able to realize the deficits, the contrasts, the challenges, and if maybe they're dealing with anxiety or depression. And so this is a really great conversation to have as to the outside, how people see you is here, but how you're really feeling is over here. And what can we do to be able to find that middle ground, to be able to help find ways where the outside seeps a little bit into the inside, and the inside is less stressful and less overwhelming. And I love the way that when you do art in general, or art therapy in general, but also with the mask, it's not me saying to the client, you present really happy, you look as though things are going really well. Tell me about how you feel on the inside. They're actually using the art to be able to inform themselves. Really powerful when you figure out what you need to do versus you being told what to do.
Absolutely.
And so this piece of art could maybe be 3 or 4 sessions down the road. We could continue to work on the themes that are presented here. And it may be in the 4th session or so, we bring the mask out and we are curious about what words still apply or don't apply. So the ability to look back on your work and to be able to say, wow, I've shifted a little bit. I could maybe add a few more positive words to the inside because I don't feel quite as sensitive. I don't overthink things. I catch myself when I'm overthinking. My stress level's not quite so significant. And also, if a client was to use a color on the inside, we might talk about, if it was a black inside of the mask, we might talk about maybe 4 weeks later after we've done some work around this, is the intensity of the black as black now as what it was 4 weeks ago? Or could you paint a little bit of that mask in a lighter color? And what would it look like? And give them a chance to be able to see the progress they've made so that they can feel validated in their effort as well, and really acknowledge that they are making a difference in the work that they're doing.
You also have some other things here, Barbara, that are interesting. And what are some of those things about?
So one of the directives that I often use, the population that I work with involves children, adolescents, and adults. And certainly some of the children who are middle school, so young adolescents, I guess even primary age, often have treatment goals of finding ways to manage anger. And so one of the directives I do most often with the youth is an anger iceberg. And I have 2 examples here to show you. And I think it reflects how diversified the clients are as well. So my question with the client is, imagine that your anger is like an iceberg. And so you think about the water line on the paper and you draw that. And then I would ask the client to think about how much anger they think they show. So that's the top part of the iceberg. And then I would ask them to think about how much anger do you feel on the inside? So what's underneath the water line? What don't we see, but we know that it's there? The Titanic tells us it's there. So what is that? How big is that? And this is an example of a client who created the anger iceberg. And this client felt that we saw just a small amount of anger when they were in their most angry state. But what they experienced, what they felt on the inside was significant. And able to articulate many of the emotions that they felt, which is certainly a really insightful perspective, because we often show anger, but we're feeling something else. We might be feeling jealousy, hurt, shame, worry, all those other emotions. We don't know how to show those, so they often come out as anger. So to be able to unpack all of these different emotions with that client, to be able to understand, like, why do you feel guilty? Why do you feel confused? What do you hate? What frustrates you? And to spend time working through all those emotions. That's a lot of emotions to carry around.
That's a lot of emotions.
Yeah, it's a big backpack of emotions on your back that would make it very difficult to sit up straight or to move on with life. And then just to contrast, same question, anger iceberg, same water line. What do we see? What do you have on the inside? And just the different way of expressing it. So this tells me an awful lot about this client without even having to ask any questions. I think that they probably explode when they feel angry, and we see a lot of it. And on the inside, they weren't able to articulate what they're feeling, except for they are screaming help in the middle. And so again, working with a client who expresses anger this way would be a different process than a
Yes.
client who expresses it this way. It's anger either way, and being able to help them unpack that and make sense of it and find ways to cope, to recognize when they're going to blow and what are the coping strategies that we can put in place to help that not happen, but also not keep it internalized and trapped inside for it to get to be more and more angry and a bigger explosion when you finally are triggered. So finding ways to cope with anger is a large part of the work that I do with several of the clients I work with.
So you have a wide client base.
Yes.
And so you deal with children, like young children and seniors?
Yes, I do. I have clients who are very young, 6, 7 years of age, adolescents, and I have a large number, I mean, actually all the ages when you think about it. I have men and women, transgender clients. I have a client who's a senior. So yeah, I don't have a specific age that I focus on. I'm able to work with a large variety of diversified population from every perspective, whether that's age, gender, sex, or sexual orientation. I welcome all clients.
Awesome. We're going to take another quick break, and we're going to be back in a moment. So I'm back with Barbara Collins in her studio this afternoon in Guelph, and we're talking about many aspects of art therapy, Barbara. And how is art therapy used to process memory? Memories.
Memories, yes. I think any therapy processes memories. I don't think it's not just art therapy. I think perhaps the benefit of art therapy when you're dealing with traumatic memories is that many people find having an opportunity to externalize those traumatic memories into the art, to be able to give them shape, form, to be able to understand them from that perspective. How big they are, how small they are, is a wonderful way of being able to externalize them and to reduce the stigma and the burden and the pain that they carry. I find that when I work with clients who are traumatized and I use the art and they're sharing memories from the past that are painful and hard to talk about, that the art can be somewhat of a distraction from that, and they're able to put it into the art as much as they want. It's contained for them. They can choose what they want to include, and then when it's time for them to reflect back and to help me understand what it means for them and how it makes sense for them, they can then begin to do that narrative as well. Through their artwork, and it just feels like it's a safer space for some clients to be able to have that reflection that they've created, to be able to process. And again, when they want to come back and revisit a memory and understand the progress or the growth that they've made in therapy, they have that visual of what they felt when they first came to therapy and started talking about their experience, and how it's progressed from there to maybe it takes up a smaller piece of space. Maybe the size of paper they used in their first session was very, very large because the trauma experience was very large and controlled their life. Maybe after 4 or 5 sessions, they see it being much smaller. They can tear off apart. That's another factor when you use art and you're talking about traumatic memories. If a client is able to externalize what they felt into the art, at the end of the session, they have the chance to tear it up, to stomp on it, to take it home and burn it in the fireplace. They have a chance to cathartically take those memories and get rid of them however they would like to. So when they think about, though, the hurt and the pain that they have attached to that memory, they have a new memory now, and that is that the artwork that they have taken and destroyed and processed from that perspective. So it's one more way of them being able to move on from that traumatic past.
As I look around, I do see various aspects of art on your walls, and perhaps you can share the story about that this was a part of an art show?
Yes, absolutely. It's an art show called Touched by Fire, and I invite youth to contribute art to the show. And when it sells, they receive the money. And when they are creating the art, there's no description as to what they have to create. It's just a chance for them to be able to express and to use the art in a creative way. Touched by Fire is an art show that was organized by the Moods Disorder Association of Ontario. And so oftentimes the youth that create the art are using it to share their emotions or their feelings from a mental health perspective. So it can be pretty powerful, pretty provocative images. And I always ask them to include a title as well as an artist statement, so that as the curator of the show, I can appreciate what this piece of art means to them versus just wondering what it means to them. So I have an example. Would you like to take a look at it?
Yes, absolutely.
So this piece of art was created as a contribution to the show, and this fellow asked for a very small canvas. There was several to choose from, but chose the smallest and completed it. It was a white canvas to start with, and when I asked for the name, it was entitled Hanging by a Thread, and the artist's statement was, sometimes people hang by a thread, they fall apart and need to be stitched up again. So of course I'm very curious to understand, what does that mean for this client? And I was curious to understand why painting it black first was the choice, because you had to wait for the black to dry before you could add the other colors, and sometimes being patient when you're painting can be a challenge. And so the black was representative of all the clothes that everybody wore at his loved one's funeral. And he painted it black to represent that. And then the threads, each thread was a situation in his life that he felt he was hanging on by a thread. And so being able to articulate the length of that thread, the color of the thread, how much he's hanging on, is he here or is this the end here? What can he do to tie a knot in the end of some of those threads? Who can help him tie a knot in the end of those threads so he doesn't feel like he's slipping through them, to be able to cope? And are the threads hanging like this, or are they hanging like this? So it was a wonderful opportunity for him to actually sit with the grief that he was experiencing and really not able to talk about, because it's not cool to talk about your grief. You're supposed to keep it inside. That was what he had been told and what the role model was that he had experienced. So this small piece gave him a chance to really connect with the burdens that he was feeling as a result of an unexpected death in his family.
I don't think I even have to ask you this question, Barbara, but I will anyway. What do you love most about your job?
Oh, that's a really easy question to
It
answer,
is.
Joanne. I love the opportunity to work with the various clientele that I have. Absolutely, that's the best part of my job. I am often excited when I see someone coming in, maybe sort of sitting like this, because the emotions they're carrying on their metaphorical knapsack are just making it difficult for them to sit up straight and to embrace who they want to be, and to see them work through that hard, painful work, especially when there's so much else happening in their lives and in the world around them. To carve out time in their life to be able to really focus on exploring who they are and who they want to be and dealing with the mental health challenges that they have is enormous work. The stigma associated with that makes it even more challenging. And so when someone's able to conquer all of that and be able to feel like they're embracing a better quality of life, a happier sense of self, that's a real privilege to be able to witness that.
Absolutely. I think it's an incredible modality, personally speaking, and I couldn't wait to do this interview, because I have always had an interest in art therapy, and I think I've learned a lot just sitting here actually and listening to you. Perhaps we have time for one more quick question, Barbara. What is the difference between an art teacher and an art therapist?
An art teacher has the qualifications to teach art, to teach skills to students, and also is very much aware of the quality of the art, because they are going to give them a mark or they're going to grade them on that. In an art class, you don't have a chance to work in confidence with your art. Your art is very much a public platform, and all your classmates can see what you're doing and how you're doing it, and whether it looks, they can judge it, whether it looks attractive or not. That notion of it being judged, of course, is very significant when I think about being an art student back in the day. It's judged by my peers, it's judged by myself, it's judged by the teacher. If it gets put on the wall in a display, it could be judged by many people. And yeah, at the end of the day, I may pass or fail depending on the quality of my art. In contrast to an art therapist, trained to be an art therapist, and also working under the expectations of confidentiality within the field of being a clinical therapist. So the work that the client does in art therapy is completely confidential. It never gets shared unless I'm working with someone and I say to them, you know, it would be really helpful for us to share this particular drawing with your mom, with your dad, with your teacher, with whoever they are struggling with. Could we have a conversation, and could I invite your parent in at the end of the session to be able to share your artwork? It would be shared in that situation. Otherwise, I would never share a client's art. It is very confidential, and I hold that very firmly. The client is also able to select what they want to do. They're not told, today we're going to draw a certain thing. They're given the chance to choose how they would like to use the art, what supplies they would like to use, how they would like to express whatever the challenge is that they're working on that particular day.
So Barbara, thank you very much for sharing your incredibly interesting profession. Guelph is very happy to have you, actually, and we're going to put up how people can access you at the end of this interview. And I wish you much success as you go forward and trying to manipulate, like everybody else, through these most interesting times. So thank you for spending time with me today.
Lovely. Thank you, Joanne.
You're welcome.